Getting a session from Dr. Sushma Sokar, a gynecologist. So it is regarding COVID related to pregnant women. So the session will be continued by Dr. Sushma Sokar. In the last video, we are dealt regarding COVID third wave and its impact on children. So let's begin with the session. I'll hand over it to the ma'am.
Namaste, this is Dr. Sushma Savkar, practicing OBG in Ranebennur, Karnataka. Today I would want to talk to you people regarding COVID in pregnancy and the frequently asked questions in our routine OPD basis, so which we see across. So as a routine fact, we know that pregnancy itself poses a lot of challenges, and when it comes to high-risk groups and COVID-19 is concerned, this magnification will be humongous. Since we first saw the first case of COVID in 2019, 31st December, the studies have been going on and the gathered data may help us quench our queries. So as I said, challenges will be many because we do see a lot of fear, stigma or reluctance, we can say, to visit to the hospitals. So there will be a discontinuity in the regular follow-ups and the treatment will be shut off. The mental health issues with a special reference to the mood swings and hormonal effects of pregnancy also need an address. So when we are talking about effect of COVID on pregnancy, one thinks that pregnancy itself alters body's immune system, making her more susceptible, putting her to a vulnerable category. And we also know that there will be certain hemodynamic circulatory changes which we usually see in pregnancy, which again poses a risk. Though we see that pregnant females are less likely to experience body pains, fever, like 95% of the COVID positive pregnant females are either asymptomatic or mild COVID patients. But if they develop severe disease, more likely to need the ICU facility and care than non-pregnant women. So such scenario is often seen in high-risk groups like in obese pregnant females, hypertension, diabetes, chronic kidney disease, chronic liver disease, heart disease in pregnancy, blood dyscrasias, or immunocompromised states like HIV or organ transplants. So we also need to mention certain things regarding fetal and the neonatal risks. So one baby among 4 who are born to COVID positive females require ICU admissions. This could be because of the growth restrictions or the preterm births, which are more likely to be iatrogenic when we deliver them urgently because of the respiratory compromise or hypertensive changes or any other distress. We also come to see the stillbirth rates are high among these females and neonatal deaths are also seen in very few. A multidisciplinary approach is thus warranted involving all the specialty divisions like obstetricians, pediatricians, intensivists, pulmonologists and endocrinologists. So what we call as patient pathway. This will help us triage, which will include the facility preparedness. The facility preparedness, when I mean to say it is the standard operative procedures in each individual setup, the institutional management of disinfection protocols, and the isolation facilities when we come across to the COVID and non-COVID or suspect patients. And there's need a schedule for the antenatal visits which have to be discussed with the patients prior in hand. Regarding labor and delivery, I would like to tell few words later. So there are frequently asked questions which we do come across in routine outpatient basis. So I just want to put a note on each of them, like how do I visit, when do I visit, what I can do to prevent getting infected, is there any prophylaxis, what about delivery, how will be my baby, what is for the breastfeeding thing, and what about vertical transmission, what about the vaccine. There's so many queries. So coming to the antenatal care during COVID-19, so women should be advised to attend routine antenatal care. Normally we advise a minimum of 8 visits throughout the pregnancy, but here it had to be tailored to minimum at the discretion of the maternal care provider at 12 weeks, 20 weeks, 28 weeks and 36 weeks of gestation, unless they meet the criteria for current isolation. The patient's placement will be 1 meter apart at the waiting area in the hospitals with COVID appropriate behavior. What I mean to say is with the double mask preferably, and the hand sanitizing and maintaining social distances. All these have to be put in a poster and displayed in the waiting area, so that will create an impact on the patients also. In the first trimester, when we call the patient at 12 weeks, we usually screen them for any medical disorders which were prior unnoticed or seen now. Can be given a first shot of TT injection, the vaccination of pregnancy, the blood investigations, routine antenatal investigations. We have to do a NT scan and a biochemical screening for trisomy rule out. So in second trimester, we'll have to advise them to come at 20 weeks, where we can plan an anomaly scan, look for the cervical length in the same setting. We have to do a oral glucose challenge test, which we routinely do at 20 to 24 weeks gestation, and of course the bare minimum, that is the blood pressure monitoring, the hemoglobin and the urine albumin investigations. The patients need to be emphasized on the hematinics, the supplementations of iron and folic acid tablets, the calcium supplementation, and of course the nutritional diet, balanced diet, which also plays a major role in any pregnant female. In third trimester, the next visit will be scheduled at 28 weeks, where we have to teach the pregnant female daily fetal kick count method. So where we have to advise them from morning 10 till night 10, at least minimum 10 counts of fetal kicking is a normal phenomena. When she is feeling any difficulty, any other problems to visit otherwise, next will be her scheduled visit at 32 to 34 weeks. And at this gestation, we usually come across with the apprehension and the anxiety in these pregnant females. So we have to address regarding their mental health. Assay has to be done, whether they are fit, they're having any queries, clear their doubts so that they can go ahead and come for a next visit. So if the baby kick count is less, if she is having any difficulty in fever, cough, cold, or any isolation criteria which she is having to meet the doctor, it has to be done the earliest. Another question will be when to take the vaccination again. That means the TT injection. So we prefer that we have to give a DT, that is Tdap, which covers a diphtheria part also, and which will be giving protection to the baby also. So that had to be given anywhere 28 to 32 weeks. If the baby is healthy, so we can call them directly at 32 weeks for the fetal well-being, growth scan, Doppler can be done, and the birthing route can be discussed with the patient. The routine iron and calcium supplementation have to be carried throughout. If the patient is Rh negative, she can receive her routine antenatal and TD vaccination also during this gestation. The Tdap vaccine, of course, is of a special mention, and if she has to go for isolation criteria, she has to get tested immediately. And again the question comes, I'm pregnant now, how I can protect myself against this COVID-19, whether there is any particular method or it's just like a general population. So there are few wellness mantras which have to be maintained, proceed and followed by all the population irrespective of pregnancy, non-pregnant also. Wash your hands frequently, avoid touching your eyes, nose and mouth, put space between yourself and others, cough or sneeze into your bent elbow or a tissue. So these are our wellness mantras. And remind you, there is no chemoprophylaxis. I mean, there is no medicine which we can use to prevent getting infected. And there is no self-medication also. Absolutely no scope. If you have fever, cough or any difficulty in breathing, seek early care and call beforehand and follow medical advice. But what next if I get tested positive? This is one more question which I want to tell you people is seek doctor's advice ASAP, as soon as possible, as home isolation is definitely not the recommended option, as pregnancy is categorized as moderate. Except for few antivirals where they have been used as a moderate gesture in very severe cases, asymptomatic or mild COVID pregnant patients are treated similar for a non-pregnant patients also. So near-term pregnancy there is a problem. So it needs careful triage. We have to assess the severity the earliest and discuss regarding the mode of delivery. So mode of delivery, when it comes for this topic, what the doctors tell is there is no evidence to favor one over the other. neither normal delivery, normal vaginal delivery, nor the cesarean section, neither of them have an upper hand. So it is not influenced unless woman's respiratory condition demands urgent delivery. So cesarean section is offered only when it is medically justified, as I said, when she is going in for respiratory compromise. So otherwise, if it is dictated by usual obstetric practice, any obstetric indication for cesarean section for a non-COVID can also hold good for a COVID patient also. So during delivery, we have to ensure person-to-person contact should be limited, time in labor should be limited, otherwise rest of the management is unaltered. So when we talk about this delivery, a few people, they usually ask, if I deliver normally, will I get my baby get infected, or cesarean section is better? So mind you, this is what we call as vertical transmission. So this happens, like we define vertical transmission in COVID-19 as the mother is positive between 14 days prior to birth or 2 days after birth. So we usually address this when virus is detected in the amniotic fluid or cord blood when the patient is severely ill. So we do check for these. Or neonatal blood sample and respiratory tract within 24 hours of life. So if it is negative, so vertical transmission is ruled out, which is very rare. Of course, within a small sample study, as of now what we have got, it's just 2.5% till date. Once I deliver, what next? So these are again the anxiety questions. So irrespective of mode of delivery, the NICU team, that is a neonatal ICU team, will be assessing and resuscitating the baby. They will see if the baby is stable or sick. If the baby is sick, the sick baby will be transferred to the NICU, isolation unit of course. And if the baby is stable, it will be roomed in with the mother in the same isolation ward. So the caretakers with the positive mothers could be either a nurse with a full PPE protection, or if the mother is stable, had a normal vaginal delivery and she can manage herself, the mother herself can be a caretaker, or any affected family member with COVID appropriate behavior with a double mask, with hand sanitization and with appropriate distance from the positive mother. Okay, so direct breastfeeding is initiated immediately. Breastfeeding is absolutely safe in COVID positive mothers. It's a big yes. The rooming in, the kangaroo method, the direct breastfeeding is recommended by the WHO, the Royal College of OBG and Federation of OG Society of India. They all do recommend it, baby, mother, dad, to be kept together in the isolation facility. The baby, mother, dad are to be given care as per a routine postpartum care. So they should initiate and continue to breastfeed, as evidence show secretory immunoglobulin A, immune response against COVID-19, is found in breast milk samples of positive mothers. So now we have to ensure that breastfeeding should be safe now. So what are the steps now to follow? The hand hygiene should be very frequent, including before and after breastfeeding and touching the baby. Wear a mask while breastfeeding or providing any other care to the baby. Routinely clean and disinfect all the surfaces. Collection and transport of expressed breast milk to the sick baby should be done very carefully to avoid contamination. And again, the few patients will ask, how do I know my baby is not affected? When is the baby to be tested? Is it a requirement? Is it a mandatory test? Or how it is? So how it is done as the same, the PCR test is a golden standard test, and it is usually done if the baby is stable at the time of discharge, say around about 48 hours of life, or if any time the baby becomes symptomatic, or at life, at birth, for sick babies who will be transferred to the NICU unit. Otherwise, routine vaccination is recommended. Like all other pediatric follow-ups, the routine vaccination schedule will be started. And if the baby is tested positive, there will be a 10-day observation to ensure baby is all fine before deciding for the discharge. Coming to the most important question, which are frequently asked in routine day-to-day practice nowadays frequently, is about the vaccination. And once the COVID vaccination has been approved by all the authorized organizations now, it has been put to practice also now and started also. Absolutely safe is what they have concluded. With all the studies they have acquired till now, there is no increased risk. It has to be totally encouraged for all pregnant women at all trimesters. Anybody can take, maybe at 3 months or before delivery. So anybody can take. Even the breastfeeding or lactating mothers are to be given the vaccination. So antibodies are studied to be transferred through placenta and also through the breast milk. So if the patient needs in antenatal visits, whether they're Tdap or anti-D injections after delivery, so it can be given in the same sitting as of COVID vaccination, but at a different site. So all vaccinations are safe, can be given in the same sitting. There's no need to give any time delay. So what will be the interval between two doses now? So now I have taken, and when I should take the next dose. It's same as for any non-pregnant population. And what for a COVID positive mother? Again, same as for a non-pregnant population, 3 months after recovery from the COVID-19 infection. Again, there will be a question whether Covishield or Covaxin. So both can be taken, but they say institutional administration of Covaxin vaccinations for high-risk patients such as heart disease or any blood dyscrasias, just under the monitoring of super specializations. Otherwise, anybody can take the vaccination provided it is not infected. So I would like to give few take-home messages now. The same recommendations as non-pregnant persons for avoiding exposure to SARS-CoV-19. So always follow those wellness mantras. We have to schedule the antenatal checkups as per the doctor's advice. Seek help the earliest. Breastfeeding is safe, and make the vaccination drive in pregnancy a huge success. Thank you.
Okay guys, thank you for watching, and all the information related to Gynac and pregnant women related to COVID has been given by Sushma Saukar ma'am. Thank you everyone for watching, and please do share to your friends so that everyone is aware regarding this particular topic. Thank you so much for watching.